Well, it's been 10 years since Canada introduced medical assistance in dying. And some people are very much in favor of this policy. They think it's a compassionate thing to do. You've got people on the other side who very much don't think the government should be involved in this. And then there seems to be some common ground when it comes to some stories that have arisen in Canada around medical assistance in dying, where both sides are kind of saying, hey, this really doesn't make much sense. So today we're going to try and unpack this issue and try and see if we can identify some common ground issues where maybe there is a legitimate case for reform. We've got two people joining us today who have been following this issue very closely. Amanda Achtman is the founder of Dying to Meet You, and Rebecca Vachon is the Health Programs Director at Cardus. Thank you both for taking a few minutes to talk with us about this very important policy issue. I wonder if we can just start with the history of this. I want to make sure that I've got this right and that viewers understand how this policy came about. And as far as I understand, it was a 2015 Supreme Court case, Carter versus Canada, that found that not allowing doctors to assist patients with medical assistance in dying type procedures violated a patient's charter rights. And a year later, the legislation was passed and introduced. Rebecca, is that a fair summary of how this policy came about in Canada?
Yes, so the Supreme Court case kicked things off, and then the legislation came into effect. And originally, that legislation was more narrow than what we have currently. So in 2021, we saw a dramatic expansion of MAID eligibility. So, for instance, the original legislation was intended to limit MAID to those whose death was reasonably foreseeable, although that wasn't defined, so it was interpreted very liberally. But in 2021, they took away that requirement so that you could qualify for MAID on the basis of chronic conditions or disability, and also set up the expansion that's supposed to come into effect next year of MAID for mental illness as a sole underlying condition. So this has really evolved dramatically since 2016.
And so what, I know this is a complex issue, but what is Cardus's position when it comes to medical assistance in dying?
Well, we do not think that euthanasia is an appropriate response to suffering. We think that life-affirming care is what we should be focused on, but we want to engage constructively on this issue of how are these policies working. One report that we did last year, in contrast to Carter, we specifically look at the Supreme Court decision, the evidence they looked at, and what their expectations were for what MAID would look like in Canada. And then we compared that to the actual data and found this huge disconnect. So we really want to be constructive on that, about how do we best keep Canadians as safe as possible and focus on meeting the needs that the suffering is presenting, rather than immediately turning to MAID as a fast solution.
Okay, I want to get into some of that data in a second, but I want to bring Amanda into this conversation. Amanda, what is your position when it comes to this policy?
From all of my experience and what I have seen, the request for euthanasia does not so much express a desire to die, so much as it is the expression of some disappointment. Disappointment with a lack of access to palliative care, disappointment from friends and family not being present, disappointment with the challenge of living with an illness or condition that is objectively hard to bear. We have the data in the Health Canada annual reports documenting the main kinds of suffering by people's own admission, leading them to request euthanasia. And interestingly, fear of pain and actual pain don't even make the top 5 of this list. It's number 6. The top kinds of suffering leading people to request euthanasia include an inability to engage in meaningful life activities, a loss of independence, a loss of autonomy, a loss of a sense of dignity. And that's why I think that euthanasia represents an existential crisis rather than a medical crisis so much in our country.
Okay, when we come back, I want to talk about public opinion, because public opinion in this country is very much supportive of the policy. But, as we talked about, there's some cases where it's certainly raising eyebrows no matter where people land on this issue. We'll be back in just a moment. And we're back on Second Street talking about the government's medical assistance in dying policy and whether or not we need to see any changes. Before the break, I had mentioned that there's some public opinion research that shows that the public largely supports the idea of medical assistance in dying, at least that initial criteria. And so according to Angus Reid, they found that 77% of Canadians support the original criteria, which included cases where people are capable of making decisions about their own health. They have a medical condition where death was reasonably foreseeable in the near future, and they not cases where people are not pressured by anyone into asking for MAID, and that they give consent only after being informed of all other options available. Amanda, I know you brought to light recently a case where it didn't seem like those criteria were necessarily being met. A lady was offered MAID and she really wasn't looking for it. Could you tell us a little bit about that particular case?
Sure. Well, I was recently on Vancouver Island, which really is the epicenter, along with Quebec, of Canada's euthanasia crisis, as I see it. I was traveling all throughout the island, and
Mhm.
it's true. There is a lot of support for euthanasia, partly because of how many people know someone who has opted for this, and because of the aging population on the island. So I was going deeper to engage with people all throughout the island. And on one of my last stops, I met a woman named Miriam Lancaster who shared with me that she was in excruciating pain one day. Her daughter had to call an ambulance and she was brought to the hospital. And as soon as the doctor came to meet her, realized she's 84 years old and in excruciating pain, this doctor said, "We would like to offer you MAID." And this woman was with her daughter, with her
Mm.
family, and they were all floored that before she had even found out what was wrong with her, MAID was being raised because she was elderly and because she was in
Yeah.
pain. And that really is enough to qualify in our current euthanasia regime. Well, Miriam recovered. It took about a month, but within the year, she traveled to Mexico, Cuba, and Guatemala. She says there was no reason to have been offered MAID. But here's the thing, just offering euthanasia, or even more, just knowing that you fit the criteria for a state sponsored suicide program already kills the person in a sense. It already deflates and
Mhm.
defeats a person's sense of self worth. And that's why, even if you're never going to go for it, you are affected by the social message that the criteria, the fact of having criteria at all, sends.
Yeah. It's an interesting point. I mean, I find myself on the other side of this issue where, I tend to agree with the 77% that if someone is suffering and, you don't want to see them suffer in their final years. But when I heard that point about even just what the signal is being sent when you suggest to someone, uh, it is interesting that when you think about it, that, it could change someone's whole perspective on life if others are saying, maybe it's time for you to go. I mean, that's pretty shocking thing. I want to just share a story because I've seen a bunch of these in the news where it really strikes me as, wow, this wasn't really what MAID was supposed to be about. Christine Gauthier, a former veteran, she had approached the federal government because she was in a wheelchair. She wanted to see if she could get some funding so that she could get a wheelchair ramp into her house. And when she went in to meet with federal officials, one of the things they said to her was, "Are you interested in MAID?" And it really surprised me that this would come up for someone that really is not seeking to end their life. They just want to get a wheelchair ramp, and this is being offered. Another case, Amir Farsood, a St. Catharines, Ontario man who applied for MAID because he had a serious back injury, so he couldn't work and couldn't pay his rent, and he didn't want to be homeless. And I've seen a couple stories like that where people can't pay their rent and they're off looking at MAID. It seems like as a society we could have a better option. Richard Foley, an Ontario man with a degenerative brain disorder, was told by a doctor how much it cost to have him in the hospital each day, and then he was offered MAID. So it was sort of saying to this gentleman that, hey, you're a big cost on the system. Do you want MAID? I mean, it just, these don't really seem like appropriate situations. Rebecca, I realize we don't have a lot of time, but what are your thoughts on these types of situations? Are they just small anecdotes or more common than we think?
Well, the problem is we don't really have robust data collection to give us a full sense of the scale, but we have heard from many disability
Mhm.
advocates that they're hearing these kinds of stories over and over again. And even when you look at the population data, general public opinion polling, like you mentioned with ARI, you've see some scholarly studies that have pointed to the fact that Canadians actually misunderstand what MAID is. So they think that they support MAID, but what they really support is something for a last resort and when all other treatment options have failed, and that's not what the law requires.
Okay, when we come back, we're going to continue to unpack this issue. We'll be back in just a moment. And we're back on 2nd Street talking about medical assistance and dying. Rebecca, I want to come back to you on this issue. You had mentioned that your organization's done lots of research into this, especially around some of the misconceptions about MAID. Would you mind just telling us a little bit about what your findings have found?
Yeah, so one of the things that I think is really important, especially as I mentioned, understanding public opinion polling, is that there are misunderstandings about what MAID is. So some scholarly research tested Canadians' knowledge of what MAID is, and only a minority were able to actually correctly identify what the law was, even though they said they supported the law. And when they broke it down, they found that what a majority of Canadians actually supported was MAID for last resort, MAID when all other treatment efforts had failed. And that is something that really sets Canada apart from other international jurisdictions, as we've discussed in a recent research brief where we compare Canada to other international comparators, where we don't require a terminal illness diagnosis like New Zealand or Australia, for instance, or many other countries that has kind of a set criteria of like 12 months or 6 months or something more objective, and where we don't require a patient to have actually tried any treatments to address their suffering. They just need to be informed of it or offered alternatives. And for those who are living with inadequate care of their condition, especially inadequate disability services, offering alternatives can be pretty meaningless when you've spent so many years fighting for basic care, like the story you mentioned of Christine Gauthier, who had been fighting for a basic wheelchair ramp, right? So you're adding this layer of offering MAID onto a history of struggling to access basic care. So that's one of the huge disconnects that we see between what Canadians think they support and what the reality on the ground actually is.
So you had mentioned that you want to come forward with constructive ideas and that. I mean, you've got a segment of society that polling will show, when they do understand what MAID is, they support it, right? Where people they're expected to die within the foreseeable future, the near future, I should say. They've got something that's causing immense pain, whatever. But we've gone over these examples where, I mean, it seems like it's being offered in cases where it's really not appropriate. So do you have a solution or idea where maybe the program could be reformed so that it does maybe get closer to those cases where the vast majority of Canadians do support that policy being available?
So one thing I think would be to take Alberta as an example of ways that changes can be made to better protect the vulnerable persons. So Alberta has now requiring, once the law takes effect in Bill 18, that persons have a prognosis of 12 months, right? So it gives us a more objective criteria and takes MAID off the table for those who are not actually dying. It also blocks MAID for mental illness, which was scheduled to come into effect next year. It also has heightened requirements around the provision of MAID. So one thing that it blocks is doctors raising MAID unsolicited and advertising MAID in public medical facilities, which can better protect persons by not introducing the idea of an assisted death before we've actually started treating the suffering that might drive such a request. So I think those are a good place to start, as well as with a more robust accountability and monitoring system. Because when Canada brought in MAID, unlike the Netherlands, unlike Belgium, unlike pretty much every other international comparator, we did not introduce a national body to actually monitor and ensure compliance with the law.
Amanda, I want to get your take. Is Alberta on the right track with some of the reforms that Rebecca just mentioned?
Certainly, those incremental developments are helpful. I will say, and be very honest and sincere, that I think euthanasia is always a tragedy. And while certain cases, for example, cases of the young, cases of veterans, capture the public imagination. My heart breaks the most for those for whom there's no sympathy, for those for whom Canadians would say, well, MAID makes sense for you in your circumstances because you're very disabled or you're very elderly or you're very beyond any possible help. That is crushing. That is devastating. Nobody deserves to be regarded and written off in this way. We don't need to directly take people's lives who are dying. We can accompany them with a loving insistence that as long as they have breath, they belong. They have a place among us. One day that person will be us.
Okay. I'm guessing you're somewhat on board with Alberta then. I hear your point. It is a tricky issue, but when we come back, we're going to continue to discuss maybe where there is some other areas for common ground. We'll be back in just a moment. And we're back on 2nd Street talking about the medical assistance and dying option that is available here in Canada and the government policy and what's changing. Amanda, I wonder if you could tell us a little bit about some of the recent developments at the federal level around this idea of expanding MAID into mental health conditions.
Sure. Basically, euthanasia always gets expanded on the grounds of equality, because if euthanasia is seen as a reasonable and compassionate means to alleviate suffering, why wouldn't more and more people qualify for it? And that has been the justification for the expansion, first of all, to people who are not dying, but who live with physical disabilities, chronic illnesses, or neurological conditions. But when that was put forward in 2021, the Canadian Senate objected and said, this doesn't go far enough. There are surely people who are suffering mentally as much, if not more, than those suffering physically. And so we must expand the law to also encompass those opting for euthanasia whose sole underlying condition is a mental illness. And that law passed in 2021. However, the implementation of MAID for mental illness alone was delayed. First of all, by 2 years, then by 1 year, then by another 3 years. And so year after year, the government has been saying, we're not ready. We're not ready to offer euthanasia to those whose sole condition is a mental health related one. And the reason is because it's impossible to predict irremediability, and because it's impossible to differentiate a so-called rational suicide request from ordinary suicidal ideation, which is what a lot of those working with people struggling with mental illness are contending with. And so just recently, there has been a parliamentary committee debating and studying this, and it looks like the recommendation of that committee will be to indefinitely put a pause to this MAID for mental illness as a sole condition after many years of debate. And it's something to watch for sure. Many have been advocating.
Okay, Rebecca, what's your take on the recent developments? Are they do you think that Ottawa is going to strike the right balance, or do you think that this is kind of a temporary pause? What's your crystal ball telling you?
Well, I'm really hoping that the reporting we saw from the National Post recently, that this is the recommendation they're going to make for an indefinite pause, goes ahead, because I think that's the only sane solution to this. You can't ever become ready for this kind of introduction of MAID. There's been so many psychiatrists, the chairs of psychiatry from medical schools across Canada, suicide prevention organizations, disability advocates, mental health advocates have all been raising issues about how this is already impacting suicide prevention, how this would continue to undermine the message that life is worth living and we're going to fight for your life, and even in those moments where you do not feel that you want to continue living. This would have seismic impacts in mental health and recovery. And we know that this is already a system that is not doing well. We need to get better at actually providing mental health care for Canadians and supporting one another in bonds of solidarity so that we can move through these really difficult moments and have a really meaningful life, regardless of the mental illnesses that we might face. So my hope is that the government takes what this recommendation is anticipated to be and puts it speedily into legislation to block this. So we're not debating this every few years, but we just move on and move towards better mental health for Canadians, not the consideration of assisted suicide for those with mental illness.
Okay. If people are interested in more information on your organization, where can they find it?
So Cardus.ca is our website. If you go to the health program, you find lots of our work on this issue, but also on issues like palliative care, for instance. So we want to approach this in a holistic manner, not just focused on euthanasia.
And Amanda, what's your website?
dyingtomeetyou.com.
Okay. Listen, thank you both for taking a few minutes to chat today.
Happy to be here.
Thanks for having us.
Well, needless to say, the whole issue around medical assistance in dying can be a controversial one in Canada with lots of different views. Thank you as always for joining us to learn more about this issue, and we hope we'll see you again next week.